Hello! In honor of Mental Health Awareness this month, I'd like to share a few things with you. First, don't let a person be defined by their mental health or medical diagnosis. For instance, when someone gets diagnosed with a brain tumor or breast cancer or skin cancer, we don't let that medical diagnosis define them, do we? It's the same with mental health. If we do that, it's like saying that the one thing that's going on wrong with their body is defining everything about them. For instance, just because one thing's wrong with your brain doesn't mean everything isn't working. So I'd like to keep that in mind. Don't let a person be defined by their medical diagnosis or mental health diagnosis. 2, separating the person from the problem. This is called externalization. I do this a lot when patients come to advanced care for therapy. They come in and they feel like there's a stigma of them even seeking help, but they're coming here because they got a referral from their PCP. That said, what I do is externalize them or she or her or him from the problem, such as whether they're suffering from depression or schizophrenia or anxiety. Separating it makes them understand, oh, that they're actually suffering from something. It is not them. It is not who can define them, if that makes sense. So instead of walking around saying she is breast cancer, we don't do that. We don't say he is brain tumor. What we say is he has a brain tumor, or she has breast cancer, or she suffers from skin cancer. It's the same with the mental health diagnosis. What I like to do is say she has bipolar disorder, he suffers from depression, he has schizophrenia. Again, separating the person from the problem. Lastly, just talk about it. So it can be very sensitive to talk about your mental health diagnosis or something you think you're suffering from or struggling with. But first turn to your social support network for help. That's what they're there for, your family and your friends. Turn to them when you're feeling down or stressed out, and perhaps they can help first. After that, if you think you need further help, then I would suggest that you see your primary care provider and get a referral if when necessary. And they will be the first to decide whether or not you would need a behavioral wellness referral.